What are you doing, Dad? Let me do that.
I just wanted some water.
Oh, yeah.
I thought you were coming here after you dropped Layla at nursery.
Yeah, it's 10 o'clock, Dad. I've just come from there. How are you feeling?
Tired. And the drugs don't seem to be working that well today. I don't want to scare her, but it's never been this bad before.
You haven't eaten. Are you not hungry? Why has no one been in and seen that he's in pain? How long has he been lying here on his own? I'll go get the nurse and see if they can get you something more for the pain.
Hello, Mr. Aldridge. How are you feeling? Mr. Aldridge, can you tell me how you're feeling?
My side and my chest.
Right. Has it been like this before?
Not that bad, no.
Okay. Well, I'll go get some painkillers for you and we'll come back and check on you. But I think the doctor should come and see you because you're clearly in more pain.
Should I put the music on, Dad?
Sorry to interrupt, Doctor. Do you know Mr. Aldridge?
Let me see. Oh, yes, the gentleman with lung cancer and COPD admitted with renal failure and a chest infection.
He's got some pain and he's just not quite right.
Have you checked his obs? In what way is he not right? Is it just the pain?
He isn't eating and he's in quite a lot of pain. His ops are fine, but in handover, everyone has the sense he's just not improving. I just gave him some Oxynon, which has helped.
It says here he was responding well to fluids and the antibiotics. What's changed?
I don't know, but he's very weak.
Okay, I'll go and see him.
Thank you.
Hello, James. I hear you're in quite a lot of pain today. Can you tell me how you're feeling?
Why can't Dad just see the same doctor? Who are all these people? Do they even know what they're doing?
Do you mind if I turn your music off while I listen to your chest, James?
Not at all. Do you like it?
I do. I don't know much about jazz, but I'm enjoying this. Who is it?
It's him. It's my dad. He used to play the trumpet, and I love hearing his old songs.
Wow, that's pretty cool, James. We'll have it back on in a moment once I've examined you. Okay, that's great. And I'm going to need a nice deep breath in and out. And one more time. In and out again. Fantastic. Let's get yourself back down. Okay. You're in a lot more pain today, aren't you, James?
I'm not getting any better, Doctor.
We don't know that for sure. Let's do some more blood tests and we can check a few things out, all right?
I mean, can't you try something else? A different medicine? They stopped the chemo because it was making him feel sick, but what if it was actually working?
I can't keep fighting anymore. I wish the doctors would just make it clear to her that I am getting worse.
Let's just get some tests done and we can go from there.
So you don't actually have a clue as to why he's in more pain then, do
Let
you?
the doctor do her job, love.
I'll ask Dr. Evans to come and see you and we can take it from there, okay?
It's not looking good, right?
I'd really like to speak to the consultant first. Then we know exactly what we're looking at. I'll be back as soon as I can, okay?
Hello, all. Is now a good time?
All done here.
Do stay, please.
What's going on?
Hello, Grace. I understand you're Mr. Aldridge's daughter. How are you?
Yeah, okay. What's this about?
I've been speaking with Dr. Jeffrey, and I thought it would be good to see where things are up to. Is now a good time?
As good as any. I ain't going anywhere.
Are you happy for everyone who's here to stay in the room?
Of course.
Firstly, I'm glad that the new dose of oxycodone has got on top of your pain. However, I'm afraid it's not all good news. Unfortunately, the recent scan has shown that the cancer has spread further through your lungs and that there are more sites of disease in your bones. Also, the kidneys aren't getting any better. This explains why the pain is worse and why you're more sleepy and feeling nauseous. Any questions so far?
No, I think I know where this is leading.
Sorry, I've got to take this.
Mr. Aldridge, what's your understanding of what's causing you to be this unwell?
Well, you said the cancer is spreading and you can't stop it, can you? And my kidneys packing in too.
Your kidneys aren't working so well, and the chest isn't responding to the antibiotics. The cancer's taking hold now, and eventually it's going to win.
Win? Is it some kind of game to you?
Do you mind if I sit down? I'm sorry. What I mean is, I don't think we're going to be able to change what's happening. We're dealing with the cancer, the COPD, and the kidney failure. I'm sorry, we had been hoping for the best, but I think it's time now that we plan for things not working out as well as we all hoped.
This can't be right.
Are you okay for me to continue? We're going to deal with your symptoms now, James. Would you like me to tell you a little bit more about what to expect?
Not particularly. All I want to know is how long I've got.
Don't speak like that, Dad.
No, it's okay to ask. What do you think, James?
Not very long.
I think you might be right, James. It's difficult to say for certain. What we look at is how quickly things are changing, and things have deteriorated for you in these last few days. It's difficult to say, but we may be looking at days or short weeks.
Well, I guess it's probably only days now.
There are a few more things I'd like to discuss with you, if that's okay with you, James. Is it okay for me to continue? Do you have any thoughts about what is important to you? For example, where you'd like to be cared for when things deteriorate?
Well, I always want to die at home like my wife. But I don't want to be moved around now. And I don't want no more pain.
Look, you don't need to make a decision straight away. Have a think together. Now, is there anything else that's important to you in regards to your care?
I've got my daughter. And that is all I need. I don't want to be in pain anymore.
Just so I'm sure what you're saying, it's important to have your daughter with you and you're concerned about the pain. Grace, you can stay here with your dad. As for the pain, we can make it a priority to make you as comfortable as possible. There is one more important thing to tell you about. Has anyone ever talked to you about resuscitation before?
Dad, I won't let them give up on you.
We'll do everything that we think will help, but resuscitation is specifically about what we do or don't do if someone's breathing stops or their heart stops.
I can't give them permission to let you go.
Grace, you need to understand we're only making this decision because we don't want to put your dad through something that we don't believe will work. In your father's case, it's the cancer and the kidney failure that are making him unwell, and these are things that we can't reverse anymore. So resuscitation wouldn't be helpful in this case. I have to make the call. I'm responsible for the decision about resuscitation with the other staff here. I need to check what you think and make sure you both understand why I'm making this decision.
I remember with your mom, Grace, all this pulling around. If I have to go, let me go peacefully.
Thank you.
So there's no more treatments. It's just painkillers now.
We're keeping you on the oxynorm for pain, but we'll only use as much as you need to be comfortable. However, I think we should continue with the antibiotics to help with symptoms of your chest, if that's okay by you. Although I don't know if we can get rid of the infection, I think it might still help.
I don't understand. You're still treating his chest infection, but not his cancer?
As I've said, your dad's too weak for any treatment to target the cancer. Our priority now is to make your father comfortable. The antibiotics, the painkillers, and the drip can do that. And it's important to remember, James, that you can eat and drink whatever you like, although you may not feel like eating much. Does that all make sense?
So that means I don't need to have any more blood tests? I'm tired of being prodding and poking all the time.
I think that's very sensible. I'm not sure that regular blood tests are going to change the management of your symptoms at this stage. Now, is there anything else I can help you with?
Well, I don't know. There's so much to take in.
I can come back and see if you like to go through anything later if you like, James. Or I can ask one of the chaplains to come and see you. They will listen and chat to anyone. You don't have to be religious.
I used to believe in God, but I'm not sure what I believe in anymore.
You're beginning to look tired, James. Shall we go now and let you get some rest?
Yes, please.
Okay, we'll go now.
Thank you, Doctor.
I know this must have been very hard for you, Grace. The team can talk to you more if you want, or if you need any emotional support, we can happily...
I just want to be with my dad while I still can.
Let's capture what we've just discussed here so that everyone knows the plan of care.
It's okay, Dad. It's okay. I'm here. There you go. You're a fighter, Dad. You'll get through this. You've beaten this thing before. You can do it again. I know you can.
Does she really understand what's going on? I'm so worried about her.
Hello, James. How are you today? It's cold outside, huh? It's quite busy out there as well. I hope the traffic isn't keeping you up. Your father's having to put up with me rambling on. I'm sure he's glad you're here now. Aren't you, James?
Can he hear? I've been talking to him all morning and it's hard to know whether it's worth it.
Well, I think it's sometimes just as good for us to talk to them as it is for them to listen to us. Here, we should put his music back on too. The CD's finished.
But then if he can hear us, does that mean he can feel? What if he's in pain and if he can't tell you what he's feeling?
Good question. If he's frowning or grimacing, that may indicate that he isn't comfortable. But we do have a syringe pump here running with painkillers in it. His symptoms are well under control. We will continue to monitor and care for him. I promise. Touch is important too. You can still touch him or give him a hug. Don't you agree, James?
Can I just talk to you?
Yeah, of course.
Well, what about how will you know when you know? I mean, he's sleeping so much already that I think he's already...
Your father's breathing is quite shallow, but it's usual for people to get pauses in their breathing. I know it's hard for you, but he won't be aware of it. Eventually, his breathing will stop altogether.
I mean, is it the medication that's doing this? Are you making him sleep?
We're being very careful to only give him what he needs to prevent the pain and to stop him from being restless. He's sleeping so much because his body's exhausted from fighting the disease. This must be very difficult for you. Do you have someone supporting you through all of this?
Yeah, my friend. She's been really good. She has my daughter when I've been here.
Good. He's peaceful now. Why don't you sit with him? I'll pop back in later.
I can't believe it. Don't they know there's someone dying in here? Stephen,
Chris? You okay?
can you have a look? I think he's...
I'm sorry. He has died. Do you want me to call somebody for you?
No, I just want to be with him.